non-suture methods of tissue apposition are techniques used to close wounds, repair tissues, or join surgical sites without using traditional sutures. These methods offer advantages such as reduced procedure time, decreased risk of infection, less tissue trauma, and improved cosmetic outcomes. Below are the primary non-suture methods. 1. Adhesive substances. These are medical glues or sealants used to bond tissues. A. Cyanoacrylate tissue adhesives. Description: synthetic glues such as N-butyl cyanoacrylate and 2-octyl cyanoacrylate form a strong polymer bond upon contact with moisture. Uses: suitable for skin closures, minor lacerations, and superficial incisions. Advantages: quick application, waterproof seal, antimicrobial properties, no need for removal. Limitations: limited strength, unsuitable for high-tension areas, and potential for allergic reactions. B. Fibrin glue. Description: composed of fibrinogen and thrombin, mimicking the natural clotting process. Uses: used in vascular, gastrointestinal, and thoracic surgeries, as well as for tissue reinforcement. Advantages: biocompatible, promotes healing and minimal inflammatory response. Limitations: risk of disease transmission if derived from human plasma. C. Polyethylene glycol-based adhesives. Synthetic hydrogels used for sealing or bonding tissues. Uses: applied in neurosurgery, ophthalmology, and cardiovascular procedures. Advantages: flexible seal, good tissue adherence, and minimal cytotoxicity. Limitations: expensive and less available. 2. Staples. Description: metal or absorbable polymer clips that provide rapid closure of incisions. Uses: commonly used in abdominal, thoracic, and orthopedic surgeries. Advantages: speed, strength, and suitability for large incisions. Limitations: can cause scarring, discomfort during removal, and is less suitable for cosmetic closures. 3. Clips. Description: small, biocompatible metallic or polymeric devices that secure tissues or blood vessels. Uses: hemostasis in vascular surgery, gallbladder removal, and anastomosis. Advantages: minimally invasive, quick application, and minimal tissue damage. Limitations: potential for migration and limited use for cosmetic purposes. 4. Zipper device. Description: a device consisting of 2 adhesive strips connected by a zipper-like mechanism. Uses: for temporary wound closures in trauma cases or surgical procedures. Advantages: adjustable tension, painless application, and removal. Limitations: high cost and limited availability. 5. Surgical tapes, skin closure strips. Description: sterile adhesive tapes used to close superficial wounds. Uses: used for small lacerations, minor surgical incisions, or to reinforce sutures. Advantages: easy to apply, reduces scarring, and avoids tissue penetration. Limitations: lower tensile strength and less effective in high-tension areas. 6. Stapleless skin closures. Description: elastic or adhesive-based systems that align wound edges without metal staples. Examples: devices like zipline closures and adhesive skin approximation systems. Uses: ideal for linear surgical incisions. Advantages: no need for removal, reduces scarring, and suitable for patients with allergies to metals. Limitations: expensive and limited to specific procedures. 7. Laser tissue welding. Description: use of laser energy to heat and seal tissue edges. Mechanism: denatures proteins, causing coagulation and tissue bonding. Uses: applied in vascular, nerve, and ophthalmic surgeries. Advantages: precise, minimal damage to surrounding tissues and less postoperative inflammation. Limitations: high cost, need for specialized equipment and expertise. 8. Microneedle-based devices. Description: devices that use arrays of microneedles to pin tissue layers together. Uses: repair of superficial lacerations and small incisions. Advantages: minimal pain, no need for sutures, and faster recovery. Limitations: not suitable for deep or high-tension wounds. 9. Pressure devices. Description: clips, clamps, or bands that apply mechanical pressure to approximate tissue edges. Uses: often used for temporary closures or in minimally invasive surgeries. Advantages: quick and efficient. Limitations: not ideal for long-term closure. 10. Hybrid methods. Description: combination of adhesive substances, staples, or tapes for enhanced closure. Example: fibrin glue combined with staples for enhanced wound stability. Uses: complex surgical repairs requiring robust tissue adhesion. Advantages: improved strength and healing. Limitations: more complex application. Conclusion: the choice of a non-suture method depends on factors such as wound size, location, tension, cosmetic considerations, and patient-specific needs. These alternatives often provide faster, less invasive, and cosmetically favorable outcomes compared to traditional sutures.